The COVID-19 pandemic has tested many aspects of our human condition. It has particularly had a toll on our mental health individually and collectively. There's been a lot of shock, change, and much to grieve and process. It didn't even dawn on me personally until I went to Vancouver International Airport on my flight here to see the empty airport and recognize the situation we truly are in, with a vulnerability with our economy and not seeing people, the crowds that I'm used to seeing that mark a healthy industry. We are in challenging times. I recently spoke with a nonprofit organization, Not 9 to 5, that advocates for mental health awareness and support for the hospitality industry. Of the many industries hit by COVID-19 shutdowns, the hospitality industry is perhaps one of the most vulnerable, and is certainly an important part of my constituency and British Columbia. According to the Mental Health Commission of Canada, substance use, socioeconomic insecurity, and unemployment are high-risk factors for suicide and suicidal behavior. According to Not 9 to 5, the hospitality industry already had a severe mental health crisis on its hand before the coronavirus pandemic, but now with the added challenges of isolation and anxiety caused by the pandemic, a rise in suicide rates is expected. This points me to a greater overarching pandemic. Hospitality is one industry, but Canadians at large are facing an unprecedented time of trauma, fear, anxiety, and hopelessness, with all the challenges of financial loss, isolation, fear of the COVID-19 virus itself, and uncertainty about the future. And I know many have not had a chance to grieve and come to terms with what's happening right now. And in a matter of weeks and months, I don't even know what that will look like. So it is at a time like this that I feel that it is important for us as parliamentarians, and especially for the government, being in a position to take action, to really consider the long-term impact of this crisis pertaining to mental health, and perhaps view the situation as an opportunity to do a reset in how Canadians perceive mental health and how we respond. That perhaps it's not something that just should be left to the provinces, but that there should be a federal framework that we can provide in trying to provide not only immediate intervention, but long-term solutions. So I would ask all members across all aisles to consider what that framework would look like to not only help Canadians through this pandemic, but set a long-term course where mental health care is accessible and part of everyday care like physical health care. In 2006, the Conservative government legislated the Mental Health Act. We acknowledge the need for oversight on mental health, but it's been 14 years. We need to revisit mental health and take it to the next level. There's no better time than the present, and if necessity is the mother of all invention, let the necessity of oversight and funding for mental health care today, in partnership with all tiers of government and frontline organization, mark its beginning.